Long before the COVID-19 vaccines were approved, CDC recognized that a critical part of increasing COVID-19 vaccine uptake will be building vaccine confidence. Thank you to the organizers for inviting me to speak to you today about our approach to this important issue. As this poll from the Kaiser Family Foundation shows, geography, race and ethnicity, political affiliation, type of employment, and other factors can affect vaccine confidence. In general, men are more likely to be hesitant, while Black and Hispanic adults are found to be more hesitant than white adults. However, after completion of the first month of vaccine rollout, we have seen overall increases in persons willing to be vaccinated. Though recent polls have shown that the number of people saying they are willing to receive the COVID-19 vaccine is increasing, there is still work to do, and there are many factors influencing people's acceptance of the vaccine. It is our job to let communities know that it is okay and valid to have questions, and especially for those communities that have been hurt by societal systems, long-standing inequities in access to health and social services, an ugly history of medical experimentation, forced sterilization, systemic racism, and recent experiences with COVID-19 have hit communities of color particularly hard, all resulting in low confidence in vaccines. We also know that undocumented people may have also be afraid to get vaccinated. The communications activities and outreach efforts we undertake related to the COVID-19 vaccine really depend on vaccine confidence. We define vaccine confidence as the trust that parents, patients, or providers have in recommended vaccines, providers who administer vaccines, and processes and policies that lead to vaccine development, licensure, manufacturing, and recommendations for use. This foundation of trust is critical. Confidence in vaccines can change depending on what is going on. For example, a person may refuse to get vaccinated, but then when they hear that millions were vaccinated safely, they may move into passive acceptance or even demand. An expert working group chaired by WHO has developed a behavioral model specific to COVID-19 vaccination uptake. The factors associated with COVID-19 vaccine uptake are what people think and feel, social processes, motivation, practical issues. Each domain can be measured to understand barriers and enablers of COVID-19 vaccine uptake. CDC's efforts to build vaccine confidence and conduct outreach are under the Vaccinate with Confidence strategy noted here. Our strategy has 3 pillars: build trust, empower healthcare personnel, including community health workers, and engage communities and individuals. In building trust, our objective is to share clear, complete, and accurate messages about COVID-19 vaccines and take visible actions to build trust in the vaccine, the vaccinator, and the system in coordination with federal, state, and local agencies and partners. We also want to promote confidence among healthcare personnel in their decision to get vaccinated and to recommend vaccinations to their patients. And we want to engage communities in a sustainable, equitable, and inclusive way, using two-way communication to listen, build trust, and increase collaboration. We have therefore engaged in a number of initiatives to achieve the goal of vaccine confidence, including instituting phone and virtual one-to-one support for state and territory immunization programs, local health departments, and immunization coalitions. We also are implementing a rapid community assessment guide using tools such as a vaccine rollout template, key informant interviews, a listening session, observation, and traditional and social media monitoring. The FACT Alliance represents a partnership initiative to bring together trusted community-based messengers to develop culturally sensitive messages and strategies to increase COVID-19 vaccine confidence and uptake among communities disproportionately affected by COVID-19 morbidity and mortality. CDC is leading the FACT Alliance to collaborate with trusted key messengers who can help bridge the gap between the government and communities of color on creating appropriate messages, materials, and promote promising solutions to build vaccine confidence. CDC funds minority-led national organizations, including minority-led professional associations. Some of these organizations will provide subgrants to local chapters to support community-level action. We will also support our established network of funded recipients that include local health departments, community-based organizations, federally qualified health centers, all within our immunization and community health programs to focus on vaccine awareness, access, and confidence. Funding also can support national level organizations to provide support to local branches, chapters, and community-based organizations, as well as deploy vaccination educational campaigns as part of their broader communication strategies. Finally, of course, our vaccine confidence requires an ongoing safety monitoring program that I want to discuss with you today. CDC has implemented a number of models to monitor vaccine safety, including active surveillance through the use of vSafe, or the after vaccination health checker, passive surveillance through the use of the vaccine adverse event reporting system, and individual case consults through our clinical immunization safety assessment project. Data from all these systems are fed into a large linked database monitoring system. Recent data from our systems shows, of course, that we, as of earlier this week, are up to almost 45 million vaccinations having been given, at least the first dose, with about half for each of the 2 vaccines that we have available. Our data on registrations into vSafe is not quite as recent, and we are reporting pregnancies within vSafe, as you can see. And so some of the early data that was reported based on our lock point from January 14th does show that while pain continues to be something that people experience with the vaccination, whether it's the first or second dose, other symptoms such as fatigue, headache, myalgia, and chills seem to be much more common with the second dose of Pfizer compared to the first. We look forward to the next data set to be able to see whether we are seeing similar results with the second dose of the Moderna vaccine as we obtain that data this month. So I want to thank you for your interest and happy to answer any questions in the Q&A session.